Hey guys, welcome to my channel. So today we will be talking about mandibular nerve. This mandibular nerve is actually a branch of trigeminal nerve. Trigeminal nerve gives off three branches: ophthalmic, maxillary and mandibular. Ophthalmic and maxillary are sensory branches and mandibular is a mixed branch. That means it has sensory and motor both. Right. So ophthalmic is going to supply all your areas around eyes, some part of your nose and the frontal region of your scalp. Maxillary is going to supply your maxillary tooth and a small structure of your nose as well. Mandibular nerve is going to supply your entire mandibular along with your temporal region. So let's learn little bit about the course of the trigeminal nerve. So basically there is a large sensory root. This is your large one and the motor root is your smaller one. So this large sensory root, it will enter the lateral part of trigeminal ganglion. This is your trigeminal ganglion and this is going to enter the lateral part of trigeminal ganglion. And then after that, it is going to exit from the skull like that, right? But this motor root, after emerging from pons, it is going to go or pass under the trigeminal ganglion and then exit through your foramen ovale and unite with the sensory to form a mandibular nerve. Right. So your ophthalmic and maxillary nerve are going to emerge from the trigeminal ganglion itself. Right. But your mandibular division forms only after your motor and sensory root have united. So what happens is after it exits from the foramen ovale, it is going to pass around the tensor tympani and tensor palatii muscles and gives off branches. And it will also give a branch that is medial pterygoid and nervus spinosus. So this is your main trunk part. After it gives off branches to these muscles, it is going to divide into anterior branch and a posterior branch. So anterior division is a smaller division, but posterior division is a very large division. So from anterior division, it is going to supply to your masseteric muscle. The branches are basically masseteric nerve, deep temporal nerve, buccal nerve, and nerve to lateral pterygoid. Right. But from your posterior division, it will first give you auricular temporal nerve, then your lingual nerve, then your inferior alveolar nerve. So this is basically inferior alveolar nerve, which will go down and give some of the branches like incisive branches, mental nerve. It will also have a branch to mylohyoid and anterior belly of digastric. So if we recall the branches, let's learn it like this. From the main trunk, you have nerve to medial pterygoid and meningeal branch. So meningeal branch is also called as nervus spinosus. How to remember this? We have to remember a mnemonic as triple M or 3M. To remember that main trunk supplies medial pterygoid and meningeal branch. From anterior branch, we have how to remember this. See, it is going to supply mostly your muscles of mastication. So what are the muscles of mastication? Masseter, temporalis, lateral pterygoid, right? Apart from that, we can remember buccal, a long buccal nerve. So these are the branches of anterior branch. From the posterior branch, you have auricular temporal nerve, lingual nerve, inferior alveolar nerve. Apart from this, it also gives branches to mylohyoid and digastric. This inferior alveolar is going to give branches as incisive and mental branch. So this is a flowchart depicting the same branches. So you can make this beautiful flowchart in your exam sheets and maybe impress your examiners, right? Okay. So very important thing to learn is what are the areas that are exactly supplied by these muscles. So nerve of medial pterygoid is going to supply mostly your medial pterygoid muscle. It will also give off branches to your tensor tympani and tensor veli palatini, right? So remember, this branch is going to supply all these three muscles. Okay. Then we have a meningeal branch. So it is going to go in your brain meninges. Then after that, your anterior branch is going to supply almost all your muscles like temporalis, masseteric. Okay, this buccal is going to supply your cheeks. Right? Lateral pterygoid is going to supply your lateral pterygoid muscle. Right? Then your lingual nerve. Lingual nerve is going to supply your submandibular gland, sublingual gland and anterior two-third part of the tongue. Inferior alveolar nerve is going to supply almost all of your teeth that are there in your lower arch. Anterior belly of digastric is digastric branch is going to supply anterior belly of digastric. Mylohyoid is going to supply mylohyoid muscle, right? Incisive to incisive foramen, mental to mental foramen, okay? And your auriculotemporal nerve is going to supply mostly your auricle and temporal region, and your scalp included, right? So these are your areas supplied. So this was actually a very small topic. So if you like the video, please like, subscribe and share, and you can comment down any more topics that you would like to know. Till then, thank you.